Hello everyone, welcome back to Med-Surg Mentor. Today let's discuss about a condition that affects the intestine, and that is intestinal obstruction. It is a blockage that keeps food or liquid from passing through the small intestine or large intestine. Okay, let's get started. Definition of intestinal obstruction. Intestinal obstruction is a significant mechanical impairment or complete arrest of passage of contents through the intestine due to pathology that causes blockage of the bowel. Next is etiology of intestinal obstruction. Etiologies can be divided into two, and they are mechanical causes and non-mechanical causes. Mechanical causes are obstruction, adhesions, volvulus, intussusceptions, tumors, hernias, impacted stool, and diverticulitis. Common examples of non-mechanical causes are abdominal or pelvic surgeries, infections, gastroenteritis, opioids, Parkinson's disease, diabetes mellitus, and hypothyroidism. Pathophysiology of intestinal obstruction. Due to etiological factors, there is intestinal hypersecretion and reduced resorption of fluids and electrolytes. This leads to distension of the proximal intestine with edema and congestion. This leads to activation of local and systemic inflammatory response. Gradually, there is altered cell wall permeability and invasion of bacteria. Thus, it results in necrosis, perforation of intestine, and further complications. Major clinical manifestations of intestinal obstruction are crampy abdominal pain that comes and goes, loss of appetite, inability to have bowel movement or pass gas, swelling of the abdomen, constipation, and vomiting. Diagnostic measures done to rule out intestinal obstruction are physical examination, X-ray, CT scan, ultrasound, and barium enema. Commonly seen complications of intestinal obstruction are infection, perforations, and necrosis. Treatment modalities of intestinal obstruction are NPO, that is nil per oral or clear fluids only diet, intravenous fluid and electrolyte replacement, tube decompression, antibiotics, antiemetics, pain relievers, self-expanding metal stent, and surgery to relieve blockage. Important nursing diagnoses are acute pain related to obstruction and inflammation, activity intolerance related to pain and discomfort, risk for deficient fluid volume related to vomiting and restricted fluid intake, ineffective breathing pattern related to abdominal distension, imbalanced nutrition less than body requirement related to anorexia, fear and anxiety regarding disease condition, and knowledge deficit regarding uncertain outcome. Important nursing cares are assess vital signs, abdominal girth, and pain level, maintain nil per oral to stabilize the condition, explain the procedures and treatment modalities, restart oral fluid intake gradually, maintain strict intake-output chart, give ice tips frequently, use nasogastric tube as indicated to decompress bowel, watch for complications, administer intravenous fluids, antibiotics and antiemetics, and prepare patient for surgery. So far, we have seen regarding intestinal obstruction. A bowel obstruction happens when either the small intestine or large intestine is partly or completely blocked. We have also seen its etiology, pathophysiology, clinical features, diagnostic measures, management, nursing diagnosis, and nursing care. Thank you so much for watching. Please don't forget to subscribe to my channel for more informative videos. Thank you.